Perfect. All right, guys, so we're going to go ahead and get started with today's real-world testing webinar. My name is Asara Clark. Welcome to everyone who is able to attend today. We really appreciate your time. I am with the Office of the National Coordinator for Health Information Technology. I am with the Division of Certification and Testing in the Office of Technology here at ONC. I'm a senior advisor here, and I am going to be covering real-world testing for you. Today's webinar is really geared towards our developer community audience. We want to just make sure you get a complete, full overview of your requirements and expectations around real-world testing. And we want to make sure that you understand what it is that you have to do to fulfill these requirements. So we're going to go ahead and get into the presentation. Just a quick standard disclaimer that we always refer to and include into our presentations. This is completely informational. We have all of these requirements are adopted in the Federal Register through our rulemaking process. And so you want to understand that that is the authoritative content that you want to always refer to, but and we aim to keep these presentations as much in line as possible, but do understand that the the regulation is the authoritative content that you want to always refer to. So first and foremost, we're going to get into what is real-world testing, right? What is real-world testing? What is this process all about? And it is a process for health IT developers to demonstrate interoperability and other data exchange functionalities in real-world scenarios. You know, demonstrate these functionalities when their certified health IT is deployed in a real-world environment, as opposed to in a controlled testing environment with your ONC authorized testing laboratory. So I know you guys are very used to that process, but it does not demonstrate, you know, whether or not the functionality continues to perform as intended in the real world production scenario. So just keep in mind that the purpose of real world testing is to demonstrate post-certification after deployed, that your functionality still maintains that the functionality is still there, that your certified health IT is still demonstrating interoperability and data exchange functions. And we do that, you're going to do this through conducting and measuring observations of these interoperability and data exchange functionalities in the real world. You're going to ensure transparency into the processes that you choose in order to do so through your real world testing plans and results reporting. And that's how your customers know how you're measuring functionality, how you're demonstrating successful real world testing. Now, we do define what successful real world testing means in the Federal Register. So just want to note really quickly that it is that the certified health IT continues to be compliant with the certification criteria, including the required technical standards and vocabulary sets. The certified health IT is exchanging electronic health information in a care and practice settings for which it is marketed for use, and that the EHI is received by and used in certified health IT. So again, this process is intended to be transparent so that the interested stakeholders and your consumers understand how you're assessing the real world use of your certified health IT after deployed. Now, who is required to conduct real-world testing? Okay, this is a condition of certification, right, that was adopted in the Cures Act final rule, where all health IT developers with certifications that include one or more of the applicable real-world testing certification criteria within the scope of their certification must meet this condition of certification. Any of the certification criteria outlined in Section 17405A, I also have it summarized on the next slide, and we'll go through it at a high level, must be included in real-world testing activities. Now, as a maintenance of certification requirements that are associated with this condition of certification, health IT developers must submit their real-world testing plan to their ONC ACB in order for them to make it publicly available on the Certified Health IT product list no later than December 15th of each calendar year. They must submit their real-world testing results report to their ONC ACB on a date that the ACB determines in order for them to make those publicly available no later than March 15th of each calendar year. And they also should notify their ONC ACB of any nonconformities with any program requirements that are discovered as they conduct real-world testing. And then let's just cover these nonconformities really quickly because it's very much in line with what you're already accustomed to as a health IT developer with how you would deal with nonconformities and work with your ONC authorized certification body to correct them. So we understand nonconformities may be discovered during real-world testing. Sort of the point, right? We want to make sure that everything is operating, the functionality is there. But if this occurs, ONC ACBs have processes in place to help health IT developers self-report on these nonconformities, and in a collaborative manner will work with you to have them corrected. So how this all would work, you just want to do what you really would normally do when you're maintaining your certifications and ensuring that the functionality still exists and that it's still conformant. You want to familiarize yourself with the ONC ACB's process for self-reported nonconformities. You want to communicate nonconformity findings within 30 days of discovery. And you want to work with your ONC ACB to develop a plan to correct it, okay? Just want to make a note here that the health IT developer must report any nonconformities found during real-world testing within 30 days, as required by Section 174.05b to Roman numeral 1 and the final rule, Cures Act final rule. All right. Now, here are the applicable real-world testing certification criteria. I am not going to dig into every single one of them, but as I mentioned earlier, they are all related to interoperability and data exchange functionality. So you're going to have the care coordination B criteria included here, patient safety E criteria, clinical quality measures C criteria, electronic exchange H criteria, APIs covered in the G criteria, and public health criteria, which are in the F criteria. So these slides will be made publicly available after the webinar. This is a snapshot of it. Obviously, they're also going to be noted in the final rule, but these are all of the interoperability and data exchange criteria that ONC has included for real-world testing. Now, let's talk a little bit about the real-world testing life cycle, okay? We want to make sure that all health IT developers understand that this occurs on a yearly cycle, but the planning, conducting, and reporting of testing, of real-world testing for each given year means that the developers' real-world testing activities from different years will overlap, okay? So we have a clear example here where this image addresses calendar year 2022 real-world testing, the first calendar year that real-world testing is required. All right, now as you're planning for your calendar year 2022 real-world testing, you're going to start some activities in 2021, okay? So the deadline for all certifications that must be included in the following year of real-world testing is August 31st. So in this particular example where we're thinking about calendar year 2022 real-world testing activities, you're going to include in your real-world testing for calendar year 2022 all certifications to applicable certification criteria as of August 31st of 2021. Now, when you're planning, you're going to develop a plan for how you're going to conduct your real-world testing in 2022. That plan is due to be made publicly available on Chapel no later than December 15th of 2021. All right. So these are activities that are addressing your 2022 real-world testing and how you'll conduct it, but they're going to be done in the year of 2021. Now, you're going to conduct your real-world testing throughout the calendar year of 2022, but this cycle is going to repeat itself again. And then August 31st of 2022, you're going to start planning for real-world testing and how you'll develop your plan for calendar year 2023 real-world testing. So you'll be wrapping up your conducting real-world testing in 2022 as you're planning for how you're going to approach your real-world testing in 2023. That plan for calendar year 2023 is going to be due to be made publicly available on Chapel no later than December 15th of 2022. While you're wrapping up 2022 real-world testing, you're going to be planning for 2023 real-world testing. And as you start to conduct your 2023 real-world testing, you're going to have a results report due for the previous year, 2022, of real-world testing that will be due and must be made publicly available on Chapel no later than March 15th of 2023. So you can see how this is a rolling cycle, and you have to be sure that you're meeting all of the associated real-world testing requirements for each calendar year, but you're going to be conducting real-world testing as you're planning for the next year, and as you're going to be conducting real-world testing as you're reporting on the previous year. All right? So we have a nice little example for you, just because we understand that, you know, this might be a little bit of a complex timeline. So we have an example here. Just want to recap, real-world testing plans are intended to describe measurement approaches for the year immediately following the plan submission. The plan should address any health IT module certified by or before August 31st of the year in which the plan is submitted. All right, so here we have an example of two different modules, okay? Module number 1 completes certification in June of 2021. That's before the August 31st, 2021 certification deadline for 2022 real-world testing. Module number 2 completes certification in October of 2021, which falls after the certification deadline of August 31st for 2022 real-world testing. Now, you're going to include in your 2022 real-world testing plan module number 1 in this particular example. That plan is going to be due to be made publicly available on Chapel no later than December 15th, 2021, and that's where you'll address module number 1, real-world testing. All right, you're going to start to conduct real-world testing in 2022 of module number 1. Module number 2, which fell after the August 31st deadline, is going to be required to be included in the real-world testing plan for 2023, where you're going to have that be made publicly available on Chapel no later than December 15th of 2022. So module number 2 addressed in 2023's plan. Module number 1, which fell before the deadline, is going to be addressed in 2022 plan. Now, as you're conducting real-world testing on module number 2 in calendar year 2023, the results for module number 1 are going to be due no later than March the 15th of 2023 for the previous year of real-world testing, and so on and so forth. You're going to be conducting real-world testing in calendar year 2023 of module number 2. Then you're going to have another plan that's going to be due to include all health IT modules that are certified as of August 31st of 2023. That will be included in 2024's plan. Your module number 2 results report is going to be due to be made publicly available on Chapel no later than March 15th of 2024. So it's a rolling cycle, and here's where we just use 2 different examples of modules, one that is required to be certified in 1 year, the following year based upon when they completed certifications. I want to make note that this process is required on an ongoing yearly basis for health IT modules certified to applicable certification criteria. With that said, the module number 1 that we conducted real-world testing on in 2022, if that certification is still being maintained and still active, it will also be included in the 2023 plan. So you don't just real-world test your module once after it's been certified. As long as you've maintained the certification, it should be included every single year thereafter. All right. Now, we get this FAQ quite often, where we get a question of whether health IT can submit a testing plan for the following calendar year if a health IT module or certification criteria was updated after August 31st, the August 31st deadline. So just to reiterate, at a minimum, all certified health IT all certifications that have been completed as of August 31st must be included. However, developers may choose to include updates made after the August 31st deadline. We do not prohibit it. It will still be required in the next cycle, particularly with the maintenance of the certification. However, you can do it if you want to, but just know that it's required for the following calendar year. It does not have to be included in that very next year. So just remember, this cycle is ongoing. If there are updates made after the August 31st deadline and you choose to include them in the very next year of real-world testing, the required year of real-world testing falls on the next cycle, okay? So this is a question that we get all the time. You're not prohibited from doing so, but you definitely need to you definitely need to incorporate it in the following cycle, okay? All right, let me get us to the next slide here, where we're going to start talking about real-world testing plan elements, because I know that our health IT developer community is really interested in how to develop their plan, you know, how to make sure that they have a complete plan and that they are addressing everything that is required by each element. So these elements that you see here on this slide are required by regulation. Every plan must include them to be considered complete. And those are the testing methods and methodologies that the health IT developer will use in their approach, the care setting types that they will cover, descriptions of how they will test the conformance of each certification criterion, key real-world testing milestones, expected outcomes from real-world testing, the associated measures and metrics. You have to have at least one in each plan, and the justification for your approach to real-world testing. So let's dig into this just a little bit. And I'm going to actually go over each one in a little bit more detail, just to talk about how, you know, what is expected and how you want to approach making sure that you address each of these elements. So for the testing methods and methodologies, I just want to note here that there's full flexibility. ONC does not define how you are going to approach the methods for testing in the real world. Full flexibility for the health IT developer to determine the most appropriate ways to provide transparency into how they'll assess interoperability capabilities within the care settings and workflows where their certified health IT modules are used. All right, we do have some factors for consideration just to sort of jog how you're thinking about approaching your testing methods and methodologies. Those are going to be the size of the organizations that production systems support, the types of organizations and settings you're working with, number of patient records and users, system components and integrations, and volume and types of data exchange, okay? So listen, when you're thinking about the testing environment, okay, you want to just remember that the purpose of real-world testing is to demonstrate that the functionality is still there when it's deployed in the real world. So you want to first consider real patient data and real production environments, okay? We don't want to, we discourage you from using open source test platforms, because remember, this is sort of contradictory to the purpose of making sure that you're demonstrating that it's going to work in a real world scenario, okay? So we want to just bring that to your attention that, you know, although it's not specifically prohibited, developers are discouraged from using open source test platforms or test platforms specific to their products as part of real world testing. The tools and platforms deviate from the underlying goal of real world testing, all right? So when you're thinking about your testing methods and methodologies, guys, just think about the purpose of real world testing and how you're going to approach making sure that you're demonstrating functionality in a real world use case or scenario. Now, when you're designing your real world testing plan, you're going to also have to think about the care settings in which your certified health IT is marketed. I want to make specific note that you have to include all care setting types, not all care settings, okay? So all care setting types, you know, you want to make sure that you cover, but you might have one type of care setting in different in several locations for that particular type of care setting in which your certified health IT is marketed. You don't have to do each location. You just have to cover each care setting type, all right? You have to include a justification for why you chose these care settings or practice settings, all right? You want to make sure that it makes sense for how and where you're marketing your certified health IT. We have some considerations and some things to note when it comes to care settings as well. And that is, first and foremost, settings or healthcare provider types are not excluded from real-world testing based on eligibility or ineligibility for any specific federal healthcare program or initiative. Real-world testing, the real-world testing plan is not required for each individual product or each individual care setting location. I just went over that. Health IT developers may bundle products by care setting and criteria, et cetera, and design one plan that addresses each, or they may submit a combination of multiple plans that collectively address their products and their care settings. And I want to just stop here just to say, we understand that you're trying to figure all of this out, and we do have resources that will be made available where we'll go into a little bit more detail, providing some examples on what this may look like. But the bottom line is you don't have to have a plan for each care setting, but you can. It's really totally up to you as the health IT developer to make sure your approaches make sense and make sure how you're planning out your real world testing is covered. It covers each and every care setting type. Also, health IT developers should construct real world testing scenarios or use cases that test more than one care setting applicable to the health IT module. So again, each care setting type should be covered. You want to consider multiple care settings that in which you market your certified health IT. And you want to remember that you don't have to have one plan for each and every care setting type. You just want to make sure that you cover all bases here. We also have an FAQ, a question that frequently comes in, and that is what care setting type should be included in my real world testing plan, right? Again, there's full flexibility on how you approach your planning. ONC does not specifically define or limit the care settings, and we leave it to the health IT developer to determine how you'll cover each setting type. But we do have some examples that you might want to consider for categories. These are listed here, but they're not limited to those used in the EHR incentive programs. We have the link here for you to access once these slides are made publicly available. Long-term and post-acute care, pediatrics, behavioral health, and or small, rural, and underserved settings, okay? So just be thinking about specific to you, your certified health IT, your customers, the setting types in which your health IT is marketed, what makes sense for you as the health IT developer. Now we're going to talk about the key milestones, all right? This is basically a timeline, right? You want to just have a timeline fleshed out for what the specific steps you're going to take to demonstrate real world testing, all right? This may include a collection of data, different milestones or different points throughout the year where you're going to collect certain data, when you're going to maybe enter into certain care settings. Those are all things that you want to consider because you want to remember that real world testing is over the course of the entire calendar year. You're demonstrating ongoing functionality of interoperability and data exchange. So you want to think about the fact that over the course of the year, you're going to be planning certain activities that are where you're collecting data, where you're going to report back out on how you successfully real world tested and demonstrated that the functionality still exists, okay? So you want to just make sure that the milestones include details on how and when the developer will implement certain measures and collect that data. And these key milestones should be relevant and directly related to expected outcomes. Now that's going to take me right into the next slide where you're going to need to describe these expected outcomes as an element within your plan as well. All right. Now, when you're thinking about your expected outcomes, developers just need to detail how the approaches they chose are going to produce outcomes that reflect successful real-world testing. I went over what ONC states successful real-world testing is earlier on in the presentation. And these expected outcomes should provide transparency into what current and potential customers will know about your certified health IT, its effectiveness in demonstrating interoperability and data exchange functionality. They also could reflect what should not be a result of a given action, right? They should be measurable and indicate the level at which the certified health IT is providing optimal user experience for its customers. So guys, listen, when you're thinking about your expected outcomes, just think about how ONC defines successful real-world testing. How are you going to get there? How are your milestones and the activities that you're going to use, that you're going to perform to demonstrate successful real-world testing? How do they all align? How are they relevant? You want to be thinking about that as you're developing your approaches. Now, you have to have at least one measure as an element within your real-world testing plan. It must address each applicable certification criterion, okay? Each applicable certification criterion that is within the scope of your certification must be addressed by at least one measure. You don't have to have only one measure, but that's the minimum, all right? Your measure can address multiple criteria. And you want to avoid yes, no measures, pass, fail measures. Just want to take you back, and you're going to hear me say this. The purpose of real world testing is to demonstrate ongoing interoperability. So we can agree that a yes, no measure or a pass, fail measure probably doesn't reflect that. So just think about that as you're approaching how you're going to measure successful real world testing, how well you're meeting the required functionality. It must include, again, at least one measurement or metric. Developers certified health IT to multiple criteria may expect that they could consider more than one. And because applicable criteria is certified to data exchange and interoperability, we want to avoid yes, no, pass, fail measures, okay? And last but not least, we're going to talk about this last required element, which is to provide a justification for your approach, all right? So you want to justify why you're doing things, how you're doing it to meet the real world testing requirements. You know, you want to make sure that each element aligns with your overall approach and testing method and methodology. You want to make sure that the justification talks about how the care settings were chosen, how, you know, you may have chosen the particular measures or metrics you're going to use. Just your overall approach, provide a justification, okay? We just tell us why you took this approach. Tell us why this meets the requirements of real world testing. Tell us why it makes sense for your personal circumstance and how your certified health IT is marketed, the functionality that you offer, and so on and so forth. Now, that after you design your real world testing plan, you're going to more than likely utilize that same kind of format in your real world testing results, okay? We have some resources out there to help you to design your plan and how you want to pull all of this information together. I'll talk about that a little bit more later on in the presentation. But just to recap really quickly, your real world testing plans have to be made publicly available on Chapel December 15th of each year. Testing results have to be made publicly available on Chapel by March 15th of each year following the year of real world testing, all right? But for both plans and results reporting, you're going to want to work with your ONC ACB to determine the date that they are requiring you to submit your real world testing plans and results to them in order for them to ensure completeness and make them publicly available on Chapel. So this slide here just gives you a visual of between your August 31st certification deadline and the December 15th deadline for your real world testing plan to be made publicly available on Chapel, there's going to be some ACB requirements for when they want you to get it to them, for them to complete it, to conduct a completeness check. And you're going to want to make sure that you work with your ACB to understand their submission requirements because it will vary across ACBs. So get familiar with this, same as with the results reporting. Make sure you understand the date by which the ACB that you're working with wants you to submit your results report to them, and make sure that you're familiar with any other submission requirements that they may have in place. Now we're going to get into some of the required updates to certification criteria. These are incorporated into the real world testing section of the reg. All right, they're required updates to newer standards for specific criteria, but these updates are going to be accounted for in your real world testing. So while these updates are required for specific criteria, if those criteria fall within the scope of your certification, you do have to meet these you are required to make these updates, but you do not return to your certification body for additional testing. You're going to real world test it to account for these updates to ensure the effectiveness of the updates and that the certified health IT still meets the required functionality. Now, how do you ensure that you have all accounted for all of your certification criteria and the required updates to standards within those criteria or required by those criteria? You're going to first and foremost review the 2015 edition Cures update for relevant criteria updates and associated timelines. You want to work with your ONC ACB to ensure all updates for selected criteria are covered within the scope of your certification so you don't miss anything. They can help you with that. Notify customers of updates to respective products. Once you've completed these updates, you want to make sure you report these updates to your certification body, your ONC ACB, so that they can update the product status on the Chapel. And developers are going to account for these updates again throughout their real-world testing activities. Updated criteria should be integrated into your measures, and you're going to also address these when you're planning and designing your real-world testing plan. Now, these are the updates to certification criteria that are required. I'm not going to go through every single one of them, but each of these here are required updates with associated timelines, and the actual timelines and the required certification criteria vary across these updates. So submission deadlines might be different. The applicable 2015 edition certification criteria might be different. But just in a nutshell, at a high level, you have the standards version advancement process, which is the flexibility that we have for you to update your certified health IT to newer versions of standards approved by the national coordinator. I'm going to talk a little bit more about this later on in the presentation. You have your USCDI updates for CCDA. You have CCDA companion guide updates, electronic e-prescribing, security tags, ASTM, and clinical quality measures report updates. You can see here there's a snapshot of all the required criteria, or all the criteria that these updates are required by, and the submission deadlines, or the deadlines for you to complete these updates. Okay, so this is a snapshot that will also be available with the slide deck. But just want to get into USCDI a little bit more, just to give you a little bit of a high-level overview of what is required by the USCDI update. It replaces CCDS, okay? Again, it's called out in real-world testing because once you complete your updates, you're going to account for these updates, and you're going to demonstrate conformity to the updated standard within your real-world testing activities. The updates are required by December 31st of 2022. Okay, so developers are required to update their certified health IT to the USCDI version 1 for specifically formally CCDS dependent 2015 edition certification criteria. All right, and once you make these updates, include them in your real world testing plan for the following calendar year should the updates be made before August 31st of that year. If it falls into the next year, just make sure you meet the required deadline for these updates to be made, which is December 31st, 2022. We have additional information on USCDI. We actually have a webpage on healthit.com. The link is here for your convenience, and we also have a fact sheet on USCDI, which is the link is also present here on this slide for your convenience. Okay. So you want to just make sure that you're familiar. If you have any of these certification criteria mentioned here, that you cover the USCDI update before the required deadline. Now I'm going to get into the standards version advancement process. I want to give you guys a little bit more information on this. It's a flexibility, again, that allows for you to voluntarily update your health IT modules to use approved versions of the approved newer versions of standards that have been adopted in regulation. Okay. Now, updates with standards are usually incorporated by reference through a rulemaking process. I'm sure if you've been involved with the certification program for some time, you understand how that might have put us behind industry advancements and industry updates. And we have heard the developer community where, because we incorporate standards updates, or historically we incorporated standards updates through the rulemaking process, where you were not able to advance and to upgrade to the newer versions of standards that were moving with the industry, because our program sort of prohibited you from doing so because you had to use the standards that we had adopted and incorporated by reference into our final rules. So we've heard you loud and clear, and we have adopted this flexibility to provide flexibilities for approval of newer versions of adopted standards without rulemaking. Okay, it institutes predictable and timely approach within the certification program to keep pace with industry's standards development and advancement efforts. And it supports interoperability in the real world as updated standards reflect insights gained from real world implementation and use. So we established this flexibility, to address ONC's program requirements, holding folks back from being able to advance with industry norms. And we're excited to be able to share with you the process for doing so. So how does all of this work? All right. Basically, it's limited to the standards adopted in the certification criteria that are relevant to real world testing. Okay. So you'll see that it only covers real world testing criteria. It's voluntary, okay? So you don't have to do this, but you can, all right? So that's the great thing. You actually can update to newer versions of standards that have been approved by ONC for existing certifications, or you can also do it for initial certification. So if you're approaching and coming into the program with an initial certification, you actually can choose to have your initial certification to a newer approved version of a standard that has been posted by ONC. So that's the great thing about it as well. It accounts for effective implementation in real world testing. So again, should you choose to take advantage of the SVAP flexibility, you're going to have to real world test, okay? So you don't, when ONC puts out these newer versions that have been approved, that you're able to update your certified health IT to, or if you're coming in to pursue an initial certification, you are going to have to real world test it. It must be included in your next year's real world testing plan, depending upon what date you complete your certification. We've already gone over the August 31st deadline throughout this presentation, but depending upon when it falls, you will real world test it on the next cycle of real world testing that is required. Now, how does it all work? Okay, so if you decide that you want to take advantage of this flexibility and update your certified health IT or to a newer version that's been approved by ONC, you're going to have to provide advance notice to all affected customers and to your ONC authorized certification body. Now, this notice should express your intent to update to the more advanced version of the standard, the expectations for how the update will affect interoperability for each affected health IT module. Also, whether or not you intend to continue to support the certificates for the existing certified health IT module version that was on the previous or the older version of the standard. So you just want to let your customers and your ONC ACB know what your plans are, how you're going to handle the updates, whether you intend to maintain the older standard as well as the newer standard functionality, and so on and so forth. You're going to successfully demonstrate conformance with the approved more recent versions of the standard through your real world testing activities, and you must maintain the updated certified health IT modules full conformance with applicable program requirements. So again, it's fully voluntary. It's for you, the developer community, to be able to advance the newer versions that we approve. And the way that we actually consider the versions that will be approved is through a collaborative process, where we consider newer versions of standards and implementation specifications. We actually include industry input through a public comment process that we will put out every single year. So it's sort of, you see this little picture on the side, we're going to come up with, the standards updates that we're considering, put them out for public comment. We'll review that public comment, and we'll make the determinations, and the approved newer versions will be made publicly available and posted on our website in January of every single year. And the developer may start to incorporate these updates into their certified health IT 60 days after these updates are published in January. So this is the cycle. It's collaborative. We want to hear from you. We want to know what's going on, what you're seeing in the industry, so that we can consider what newer versions we're going to put out each and every year. And we also have some additional information on the standards version advancement process, where we have a page here where you can get further details about the SVAP process and the approved 2020 SVAP versions as it relates to the certification of health IT. Those can be found under the certification criteria section of the ONC website. So the versions that were approved in 2020 are already posted and available. This is the link that you can visit to access that information. And then we also have more information on the standards version advancement process, where you can get further details around the SVAP collaborative advancement process and standards implementation guides being considered for future advancement via this process. And those can be found on ONC's ISA page under the 21st Century Cures tab. All right, so we're already looking at what we're going to do for future approvals for updates to standards. So you want to get familiar with what's going on. Please participate in the public comment cycle that goes on. We want to hear from you for what we're considering and the impacts for what we actually do approve to put out for newer versions. So I promised that I would talk a little bit about some extra resources that we are going to have available. And you guys may or may not be familiar with the fact that we did put out a fact sheet back in February, March-ish this year. That fact sheet gives a practical overview of everything that I went over today. It's actually a really great overview of real-world testing. So you'll have today's presentation available to you, and you also have this fact sheet that you can refer to. You can also refer, those of you who are on the line, you can also refer to this to just kind of reiterate and go a little bit more into detail on the plan elements and how you put your plan together. So this is a very, very great resource for you that has already been made publicly available. We have actually put together a real-world testing plan template, okay? I'm sure some of you who maybe submitted inquiries through our public feedback system, centralized feedback system, may have gotten a response saying that ONC did not intend to do this, but we've heard enough from the developer community, the ONC ACB community, where we did go ahead and put together an optional template that could be used in developing your real-world testing plan. We are going to make it publicly available. It's coming soon. It has not been posted yet, but we are going to make it publicly available, okay? So when you're using the template, if you choose to use it, because it is optional, all right, you want to just make sure you check with your ONC ACB, on whether or not they have any additional requirements for submission. If you have questions, you can feel free to, work with your ONC ACB, but it's a very comprehensive way that you may be able to put your, design your plan to, make sure that you're covering all elements and pulling all of this information together in a comprehensive way for submission to your ONC ACB to conduct their completeness review and make them publicly available on Chapel. Again, solely optional, but something to be made available to you just in your thinking about how you'll pull all this information together. And we also have a resource guide coming soon. And this is where you're going to get more information. It's more so of a how-to guide to assist with the development of measures and the completion of your testing plan template. Okay, we have some examples in there, some use cases, some scenarios that can help you think and get you thinking towards how you can think about your individual specific unique circumstance as a health IT developer, your specific health IT, the specific scope of your certification, the specific, criteria that you're addressing, and how you are going to pull all of that together. So this is going to be a larger guide that you can refer to where we actually are going to put out some use cases, scenarios that are intended to get you thinking about how you should think about your personal circumstance, okay? Nothing's there that's going to define anything. I've mentioned throughout this presentation that ONC is not defining how you should approach real-world testing. We really, really know and have an understanding that you are best suited to do that. You as the health IT developer, are in the best position to determine your approaches. But we do want to put out some guardrails on how you might approach your thinking about this. And that's what this resource guide is intended to do. It's based on input collected by the developer community. If you were a part of the listening sessions that we held earlier in the year, we thank you. We definitely incorporated your feedback into this guide, and we heard you in the different sort of information gaps that we need to fill with this guide. And there are no new requirements, okay? So we're not adding any requirements in this resource. It's strictly based on what we've adopted in regulation and the input that we've received from the developer community. We also received some input from the ONC ACB community. So you can, rest assured that we're collaborating with, all of the entities that we need to and the stakeholders that we need to be sure that we provide you with a guide that is helpful as a resource. So developers do not need to wait for this guide, though, for you guys to start beginning planning your real-world testing and, perhaps, looking into developing your plans. It's purely informational. and intended to be helpful in, moving forward with your real world testing activities. So you definitely want to make sure that you're signed up for listserv announcements for the certification program and that kind of thing to make sure that you don't miss when we actually put these resources out. And I want to also make note that, we know we're going into the first year of this requirement, and we are going to continue to reach out and hear from you and to have stakeholder engagement so that we can be sure that any additional resources that we might be able to put out, any additional webinars or listening sessions that we might be able to hold, we're able to do so. So these are coming soon. The templates should be out very soon. The resource guide this summer, okay? So you definitely will have that to be able to review and incorporate into your thinking as well. And guys, with that being said, that concludes our real world testing webinar for today. We hope that everything we presented today was helpful for you in thinking about how you're going to approach real world testing. Please take a look at the real world testing fact sheet that's available online. It's a great resource to get you started as well. But again, my name is Asara Clark. If you have questions, feel free to contact ONC. Here's our contact information here. You can feel free to reach out with any specific questions. I see that there are tons of questions in the chat. We'll be sure that we review those. And as we continue to develop the resource guide, you can look for those to be potentially incorporated into the content that we will have there to address any additional questions that we received on today's webinar. But with that being said, everyone, thank you so much for joining. Again, my name is Asara Clark. It's been my absolute pleasure to provide you with an overview of real world testing requirements. Hope this was helpful. All right, everybody, thank you so much for joining. You're free to disconnect.